Good morning. How are you doing? I hope that you have a great time in Gastein. And today it's going to be a very exciting session on the EU AI Act. And the title is the EU AI Act a game changer for healthcare in Europe? And the AI Act and applications in clinical practice. So organized by the European Coordination Committee of the Radiological, Electromedical and Healthcare IT industry and Siemens Healthineers. So my name is Artur Olesch. I'm a journalist focused on digital health. I will be delighted to moderate today's session on EU AI Act. And I can promise one thing, that at the end of the session, we want to have a very clear takeaways, very clear call to action. So you will go home with some maybe inspirations and maybe a little bit more of knowledge on EU AI Act. So also good morning to our online audience, so everybody who is there on the other side of the screen. So the EU AI Act is a big deal, so we have to agree on that. It's the first law to set rules for artificial intelligence, and the Act will have enormous impact on how we use AI in medicine. It's a complex legislation, but not as complicated as it was meant to be in the first version, when the initial document had 892 pages. The final version has only 144 pages, so it's readable. The supporters of the EU AI Act say it's a milestone for the sustainable development of trustworthy, safe and sound AI aligned with the European values. In the recently published book Nexus, historian Yuval Noah Harari calls for regulating AI in the same way we build brakes in cars before we started even to develop even faster cars. So it should be also the case with AI. We are building even faster AI, but we don't have brakes yet. Recently, I interviewed a scientist from Charité in Berlin who told me that in her research on Vitro brain and open science project, it's basically critical that the EU AI Act protects citizens from the misuse of AI, such as, for example, manipulating consumers' decisions using knowledge from this Vitro brain project, that is open science project. But we have also skeptics that say, Europe is again regulating first instead of innovating. They believe we should first explore the capabilities of AI, invest in AI, and then regulate, and if regulate, then only to prevent the worst case scenarios. The opponents quote also the newest European Commission report, The Future of European Competitiveness. Inside the document by Mario Draghi, there are sentences like, the EU is weak in the emerging technologies that will drive future growth, or, for example, we are hugely reliant on imports of digital technology. Well, nonetheless, the EU Act is now a reality, so we are not asking if, but how. The challenge is to make the AI Act work for healthcare as a system, patients, healthcare professionals, and the European medtech sector, of course. And we are delighted to have representatives of all the stakeholders groups here with us on the stage, and they will join me for a panel discussion. So today, together with our experts, we will try to answer three key questions. The first one is, what are the lessons from other health regulations, like, for example, medical devices regulation and the in vitro diagnostic medical devices regulation, and how will the AI Act interact with them? The second question is, what are the potential challenges of adopting the EU AI Act, and what strategies could help to overcome them? And the third question is, how are hospitals and doctors preparing for the new AI rules, and what areas need extra focus and teamwork? So before we start, some home rules. Keep your smartphones ready, because we will have also Slido questions. So if we can have the QR code, please scan it. The password is sent. And the first question, we will have a beautiful mind cloud or thought cloud, but I will tell you later what is the question exactly. You can also upvote the questions, so please view all the questions that are asked by the audience online and on-site, and you can click a little icon and the question go up or go down. And also with us we have Mario Jędrosek from YOF Forum Gastein, who will manage Slido questions, and somewhere in the middle of our discussion, I will ask Mario what the audience is talking about and what the audience is asking. So, hi, how are you doing? Great. So we have the first Slido question, yes, and you are already answering even if I didn't ask you about this. So you are quick, even in the morning, 9 a.m. I'm really impressed. So what or thoughts come to your mind when you think of the EU AI Act? Just one thought. So what we have? Regulation, yeah, sure. Unknown, future, opportunities. Well, great to see also opportunities. Data, health, change, gaps, privacy, yeah. Technology, development. Okay, we will leave this cloud on the screen and we will follow live what is happening there. Transparency, that's also interesting. But I would also add one word that is missing here is support. And here's why. In the same way that the MDR has not limited but supported the medical industry in Europe in the long term, a similar effect can be expected from the EU AI Act, according to Marco Macea, Director for Digital, EU for Health and Health System Modernization at the European Commission's Directorate General for Health and Food Safety, DG Sante. This is a quote from Digital Health Conference in Rome this year. And we are very lucky to have Marco Macea with us today, who will give a short power message about the EU AI Act. Please, Marco.
Thank you very much. Thank you for the invitation. As you say, this is not only an interesting, but is also a multifaceted subject that we need to address. And I would like to take my impulse statement for then elaborate possibly during the panel along three lines. So first of all, you mentioned it would be nice to go back to the Slido. The first elements, I would say, trust and safety. The second one, innovation, and the third one, it's uptake. These are three dimensions that you elaborated also on your speech. Now, we have been working on AI since quite some time. Now there is a new wave of AI, and the reasons are very specific, because now we are talking about categories of AI that we didn't have before when we were calling them machine learning or big data technology. Now we are talking about generative AI, and the discourse, as you know, gets into other dimensions which are very worth exploring. And by the way, in these three elements. Now, the AI Act, it is one of these, if you want, innovation-prone regulation, together with European data space, and I will elaborate why on that focuses on these aspects, on promoting innovations, but making sure that that innovation is developed in a way that generates trust in the users being health workforce, users being citizens, users being also those who will develop applications starting from an AI that has been developed by somebody else. Now, these are aspects which are worth reflecting, so I very much say I'm very happy to be here to have that discussion, because, you know, we are building the future in terms of innovations in AI, and even in the interplay of MDR, IVDR, or the EU Act. I guess that most of the things that will come will be generated by conversations and the flow of conversation between those who are supposed to use those systems and those who are developing these systems. Now, this approach, it is at the basis of let's say, our our comprehensive, say, strategy for supporting AI. Now, the AI Act, we will unfold the discussion today on these aspects, but the AI Act is there because AI is there, and AI is there because we have access to data. So I was talking about this, supporting innovation, and I would make a link in this brief impulse statement to the sister, that is the European Health Data Space, because in the context of medicines, in the context of applications in healthcare, it is important that we do have, for supporting innovation, also access to quality data that then may result in improved capacities, both in generative AI, but also in applications more, let's say, close to statistical applications, like, for instance, in imaging analysis. The European Health Data Space, is divided in two big pillars. The first one is that I, as a citizen, will have access to my electronic health data in a way that, it's much smoother than it is today, across health systems, across solutions, and across, if you want, regions / member states, and across languages. Now, that it's already an important element because it will give the citizens the possibilities of empowering and serving the use of data and use it in the forms that they need. But the second pillar that is very close to the discussion today, it is the secondary use of data. So essentially that is opening up in a trustful way the use of data and health data in Europe. Now, why is this relevant for AI in Europe, for the development of AI in Europe? Because, you need to guarantee trust. And for those who have been, and there are also in the panel, following the development of AI and technological solutions that apply in health, we very, in developing these solutions, we adhere to principles and values that are very strict. And one of that is privacy. We saw that in, privacy, transparency, regulations, and dealing with uncertainty. Now, on privacy, developing technological solutions with afterthoughts about privacy is nowhere. So it is the concept of building solutions by design. And with the European Health Data Space, specifically on the secondary use of data, that is the principal purpose of the regulation. So enabling the trustfully reuse of anonymized and pseudo-anonymized data for specific categories of data for specific use. And I guess that will be the first interplay that we will elaborate today, and the other one will be certainly on the safety for the MDR and certainly for the certifications of MDR when it comes to putting into the market technological solutions, for instance, that evolve, and that is a major difference compared with the past. And let me touch very briefly on the third element, and then I close, and that is that it is a technological revolutions that we are witnessing now. I like the concept of unknown and uncertainty, but you see also in the topics there, what do we mean by technology that is available in the workplace, for instance, or for me? Well, it means that we also analyze not only the technological challenges that are related to the development of app, not only, let's say, the underpinnings to make sure that the technology is trustful and it is secure, but that we also elaborate and we have pictures and we map what are technological and potentially cultural challenges that may impact, say, the uptake of technological solutions in such a diverse sector like healthcare. So I'm very much looking forward for the discussion today, Arthur, and I'm ready to engage in the discussion.
Thank you very much.
So she's
Join me
from
on the stage.
Yeah.
So I hope it's not too cold here. Before I will invite the rest of the speakers today on the stage, one question for you, Marco. From the healthcare perspective, I'm interested in the way forward for interplay guidance to comply with the EU AI Act next to the medical devices regulation and the in vitro diagnostic medical devices regulation. Could you elaborate more on the timeline for this guidance, ways of involving the stakeholders, and also how we can enhance enhance the constructive dialogue to prepare for compliance?
Well, you're very well aware that the AI Act, one of the underpinnings that will follow the development and the implementations of the solutions will be the AI office. And the AI office, by the way, created and with the board already created and meeting will work on, say, of course, being the AI Act a general purpose regulations will work on different sectors, but one of these sectors will be health. And on the other side, we have the medical device / IVDR regulations, which has got the coordination group. So the first step, which is already taking place, it is to, say, create the common forum where the AI Act experts AI office and together with the with the MDR and the IDV regulations, the coordinations acts, they work together. They work together on the interplay, and as you say, they will come up with guidance on this interplay, which are foreseen, say, for Q1, Q2, 2025. And this is a process that as I was mentioning before, it will be characterized by an exchange with the stakeholders, which are already foreseen. They are foreseen in the AI Act because the stakeholders' consultations will go on. There will be a meeting also in the spring when we discuss the output of the question. By the way, it's a question and answer, so it by definition, it would require conversations between the stakeholders. And it is a timeline that, will unfold between now and spring. But there are also, if you allow, let me extrapolate even beyond the discourse that will happen between say the AI office, the MDR regulation, so the work, which is very structured, very well structured already. There are other fora where I think that we would also need to engage collaboratively. And I'm thinking, some of you may be aware of it, for instance, the e-health stakeholder group. The health stakeholder group, which sees in particularly AI as one of these subjects, will be another forum. Well, perhaps you don't discuss necessarily, let's say, the interplay that leads to the question and answer, but you can cover these three elements, which for me are important in this discourse today, that goes from trust, from supporting innovation, for instance, how to deploy the sandboxes, which will also be part of the discussions between the AI office and the MDR regulatory and coordination group. And as I said, the third one, which is the take-up of this technological solution. Now, let me stress why this is important, these conversations and developing these solutions all together. Because if we undermine in this technological development trust, then there is a big hole into the uptake of these technological solutions. And we need to manage that very carefully. So that's why this approach, risk-based, that you see both in the MDR and the AI Act, complemented with these innovation activities, including the sandboxes and the work that we are going to, actually we are already doing, in creating technological resources that opens up data for AI, are essential for this discourse.
Thank you very much, and I will invite now our panelists onto the stage. So please join me. Please stay here, of course. Please join me, Sonja Wexeli, head of Central Eastern Europe and Central Asia at Siemens Healthineers and board member of the European Coordination Committee of the Radiological, Electromedical and Healthcare IT industry. Hi, Sonja, how are you doing? Annie Kobeck, founding CEO of QMD Services, a European notified body for medical devices and in vitro diagnostics based in Austria. Hi, Annie. Jelena Malinina, data director at EuroDis, Rare Diseases Europe, a non-governmental alliance of patient organizations and individuals active in the field of rare diseases. Hi, Jelena. And Daniel Pinto dos Santos, senior physician in radiology at the University Hospital of Cologne in Germany. Hi, Daniel. So we have the second question on slide now. which is, harder than the first one and more concrete. So let's have the second question displayed. Yeah. No, the second question is due to the, the word cloud? Yeah, exactly. Due to the EU AI Act, the competitiveness of medtech industry in Europe will get stronger, get weaker, stay the same, or I don't know. I did this same poll on LinkedIn a few days ago. There were 43 votes on LinkedIn, and I'm really curious if the results are the same. Don't know on the first place. Well, we don't know the future, so of course it's hard to say right now. And that's true. So let's wait a few seconds more. Yeah, so as we see, there are a lot of people that are unsure about the EU AI Act and the impact of the Act on the medtech industry. The results on LinkedIn, the results of the same poll were get stronger, 28%, get weaker, 30%, stagnate or stay the same, 26%, and I don't know, only 16%. But we see that there are different voices, of course, when it comes to EU AI Act. And the first question is to all of you. We see that the opinions on EU AI Act are very divided. So what do you expect from the AI Act, and what are your worries? Maybe, Daniel, let's start with you.
Yeah, okay. So, I mean, I'm a healthcare practitioner, so I would expect that the AI Act helps us to ensure that the products that we use as healthcare practitioners, right, that they have been rigorously tested on a technical, on the technical aspects, and that we can rely on what the vendor tells us about performance and stuff. On the other hand, I would expect that it helps us maybe also think about then clinically validating that. I think that's something that's not necessarily part of the AI Act, but when the first step is taken technically, then we can move to the second part.
Elena, do you have more hopes or more fears?
I think both. So from patient perspective, but looking on the positive side first. So on the slide before, actually, somebody marked over-regulation. So, but I would like actually to maybe shift this perspective of over-regulating something to just creating a framework of where do we understand something about safety of the product, reliability of the product. So putting just some kind of framework in which we operate. So from a patient perspective, and those who will be using actually different types of AI solutions, this is a creation of a certain framework which would ensure certain elements that the products are actually okay to use. And I guess we will come in the discussion to that magic word of trust later, because if I just put something in the market just randomly, would you necessarily trust it? Maybe if you have a good experience. If you don't, probably you would stop using my product altogether. But let's think about it as a first step towards creation of the framework for certain products, solutions, maybe even services. Thank you.
Annie, what do you think?
So I think at least from the notified body side, so QMD service is a notified body. Actually, in my opinion, we are not starting from scratch. We already now have the MDR and the IVDR with very rigorous requirements for safety, for performance. So actually, if an AI product goes through such a procedure, it has gone already clinical trials and benefit risk has been assessed. So a lot is already there. Now we know for the AI Act is another step, and a lot of things have been done right in my personal judgment. So at least from my personal side, I a lot appreciate that the approach is very similar. So you have, again, a risk approach, you have quality management, so many elements, technical documentation, so very, very nice integration. So what we see here, the don't know, I think that is really now a lot in the community. We know much will depend on the implementation. And we have seen in the implementation of the MDR that we now are 10 years after we have not finished implementation, and I think a lot fear that that might happen again with AI. And I think we need to avoid all stakeholders together that happens again. And generally, it's a good framework, can give us a lot of opportunities. We have seen it on the previous slide, but the danger of over-regulation is there, and to find pragmatic, good implementation ways, I think that's really the challenge now for the next few months to come.
Sonja, as a representative of the medtech industry, you don't know, or you know the impact of the EU AI Act on the competitiveness of medtech industry?
Well, I hope that don't know is still valid. Because it really depends on the implementation. So as a European citizen, it's absolutely crucial that Europe goes first with regulating AI, because AI is not about to come, AI is here and AI will stay, and that could be a USP of European Union. The health data space, and you already mentioned it, is very, very close related with that. But now it's less than very good frames and words and marketing. Now it's about reality. And I hope in 1.5 years from now, I could answer, it makes industry stronger. But that depends highly on how it will be implemented. Because you mentioned it, medtech and also pharma has already a very, very strict regulation for bringing something in the market. And that the MDR includes software bringing in the market, and AI is a bullshit bingo word. It's a special kind of software, but it's not something completely different. Now we see, if we look at the MDR and the AI Act, and we are not in the rollout now, but we see it's similar, but it's not the same. And if we see, and that's nothing, and at Siemens Healthineers, we are a big company, a global company. We are currently have about 90 applications, AI applications already in the market. And but even we as a global company see that MDR makes it much more expensive to bring medical devices in the European market. It slows down the bringing in of innovations in the market. And that's nothing for Siemens Healthineers, but for smaller and mid-size innovation companies of Europe, I see it clearly that they go to US, but even more to Asia, to bring their innovations in the market, because it's too complicated and too expensive for them in Europe. And I'm a European by birth, but much more by heart. And therefore, I want a Europe and a European Union who is the front runner in all these topics and is really competitive there. And therefore, I think we really have to work on that to get it done. Because, and that's my last sentence, it's not because industry or notified bodies or whoever wants to get it done. It's about the patients. And we have really to balance. The trust is an important word, but it's also that we have to give the patients in European Union the trust that they always can get what's available and what's, of course, safe at the first moment globally. And that's what I would wish from AI Act and European Health Data Space. And I think we are not there now, but I'm optimistic that together, in discussions with all stakeholders, we will get it done.
Okay, Marco, you have heard all the voices from different stakeholders, so you can now address the hopes and the fears.
It's interesting because if we balance hope and fears, we are 3-1.
Yeah.
But what is I'm not surprised at all by the discussions and the output of this conversation, because I guess that there is unanimity in saying two things. So first is that this trust and safety component is essential to ensure that the products that go to the market are safe for the patients. That is across the board. And the second one, and therefore, say in that sense, the AI Act goes in the right directions. And the second point is that Europe goes first on something which protects value and protects the patients. We have important examples in the past, specifically on digital applications, that when going first means also creating competitive advantage for European companies, and that is in essence what most probably we are referring to. What I wanted to add, say, in this positive outlook, with reference to the implementation, is that in the UI Act, there is a distinction between technologies that are, say, more traditional in terms of AI apps, which, as you correctly say, Annie, will follow exactly the same, say, logical parcours for the notification bodies and for the session to the market. But it has also, moved to this other field of uncertainty where you would need that trust, which is technologies that, of generative purposes. And that is also an innovation that is brought into the AI Act. Together with it, following on your call for pragmatic approach, I think that in support of innovations, you also have this concept of the sandboxes, which may help member states, organizations, stakeholders to test the technological solutions and to provide analysis into that. Now, I guess, I can foresee, but I'm also looking to see the evolutions in this field, is that it is there to guarantee that the regulation it is future-proof. But most importantly, that innovations and that elements guarantees that we are on the same page when it comes to understanding whether we are going, say, for the right approach with the sandbox. So, yes, that's my take for the first round.
We will come back to that later. But now I would like to go to the roots, back to the roots. Daniel, you are the end user of the medical technologies, also technologies with AI inside. What's your perspective on AI as an end user, as a physician? Is it something that you are waiting for, you're excited about, or is it something that you are a little bit, distant and say, yeah, it's great, it's a tool, but we have to be careful? How is it at your work?
Yeah, so I'm a radiologist, and certainly radiology was the first, specialty to be really impacted by AI. And I think in the beginning there was a lot of fear, but at the same time there was a lot of enthusiasm. And I think we're generally positive about AI, and we see that there is things that AI could help us with. So I think overall the idea is positive. If I may just briefly touch upon some things that they said, I think. One issue is definitely trust, but on the other hand, interestingly, the AI Act suggests that the physician should not trust too much, right? So we should have human oversight. And I can tell you from my clinical experience, we had 3 different AI vendors in our hospital that had a solution for nodule detection in chest x-rays, which is something that we radiologists very often do. All of them obviously CE marked. So to some extent, there was some clinical validation, but interestingly, the results are vastly different. Even between versions of the same software, it's completely different. So I think, all of them obviously have been CE marked, so all of them, from the technical aspects, they were good. But then we are still missing what also has been said. Does it really help the patient, Does it really improve what I do? So I think that these are the discussions that we are now seeing in radiology more and more, that the technical aspect is one thing, but the really outcome is the other thing that we need to focus about. So yeah, but generally I would say still the mood is positive.
Yeah, if we analyze the development of AI, does AI help you at your work? I mean, how was it before AI, without AI? Was your work worse or more difficult, more complicated? Is it now better with AI?
Well, I would hope that we did a good work before, so I would say ideally it wasn't too bad before. I think, in my experience now over the years, is that the AI solutions that we have today on the market are not necessarily the ones that we really needed. They could help, but the impact is, well, it's still undecided, so still unknown if that's something that really helps. But those that we would really like to see on the market and that we would really like to use, those are maybe more difficult to develop, so those are not yet available to us. So I think that's the general feeling.
Jelena, we know now the perspective of healthcare professionals. And how about patients? What impact do you anticipate in patient care and personalized treatment from the implementation of the EU AI Act? AI promises to make healthcare individualized. Will it still be possible in Europe under the EU AI Act?
Thank you. I think from patient perspective, there is a lot of hope, especially from rare disease field, because this is exactly the field which is rather unknown, especially some diseases, ultra rare diseases, where there are very, very small number of people across the globe who have something. So if you imagine yourself for a second, if you don't have any condition, that you have a condition which nobody knows anything about. So you would be eager to use absolutely anything in the world just to know a little bit more how to help yourself or how to help your kid, because usually it manifests very early in the childhood, and it's parents who seek the knowledge and understanding what to do. So different types of solutions, they certainly can help understanding better diseases, also diagnosing much quicker, because again, everything starts from a general practitioner when the person comes with a certain concern, and the GP may not know over 6,000 different diseases at least, or maybe even more. Some of them are unknown. So tools, certain software, AI, whatever you want to call it, can help general practitioners at this level already just to refer a patient and to speed up diagnosis process. And then, of course, when we move to the next steps of care, of developing medicine, maybe some medical devices as well, because very few people have chance for treatment, actually, of their condition. Most of them have to live with the condition their entire life and manage it in one or another way. And they're extremely, extremely diverse, so it depends which system is affected, basically. So it really depends on that. So as for AI Act and the European Health Data Space, these are the regulatory tools which patients have a lot of hope that they will bring good things, as well as personalized treatments, more individualized approach, anything. At the same time, there is no blind trust in that as well, so there is quite a lot of skepticism. And I think what is really, really important is to create a certain level of understanding and never take trust as an end point. So it's not something you can achieve today and it will stay forever. No, it's like in maybe human relationship that it's constantly a process, so it's a never-ending process. You may trust your partner, but suddenly the trust will be broken, but you can restore it. And also, I think overall expectation from AI is not to be perfect, but rather understand why mistakes happen, how can we change them, and to see this process transparently. So that would be a good enough result already. Thank you.
So patients have hope regarding the EU AI Act. And Mark, please forgive me now, but EU AI Act is another administrative burden for the medtech industry. And that's a question for Annie. How do you see the impact of the AI Act on the duration and cost of certifications compared to the current situation?
So I would say it depends. It depends very strongly on the implementation acts. But just to say, where are the potential costs coming from? The first is on the costs the notified bodies have themselves. So how difficult are the application, the maintenance procedures for being designated for carrying out the conformity assessment. So that's one thing. The biggest cost from the MDR in maintaining a notified body, at least to my experience, is always the competence topic. So that is really a very, I would say, strongly regulated area with personal dossiers of hundreds of pages and very, very strict examination. We know conformity assessment is a game of competence, so competence is clear, and we don't dispute that. But again, it's of course a cost driver. So it depends on how pragmatic that can be integrated in the current procedures, how notified bodies are designated and surveyed. That's that cost. The other one is we are already now looking, of course, at software. We have software experts. So then the question is on what are procedural additional requirements for which categories of AI, and there will be probably separate ones. And also the question is who has to be involved outside a notified body. So when do we have to go to Sandbox or other institutions, or is there a EMA or other institutions involved? So this again adds cost, and the point is cost for manufacturers is twofold. The one is the actual cost, but very often that's not the major point. The major point is time to market for, especially for innovative products. You have the product ready, you have your technical file ready, and then you wait. And in the MDR and IVDR now, companies wait 1 year, even higher risk products 1.5 years. And I think it's at least in the intention of the Commission to bring those times down. Now with AI, I think we have to find together a smart solution to not add again additional time.
We have a great audience on the stage. I even planned it because we have physicians and patients, we have certification, we have industry, we have European Commission. Sonia, a question for you. You know, it's the industry that has to adapt to the new AI Act. So where is AI already used basically in the solutions, for example, by Siemens Healthineers, and how do you see AI evolving in the future? Because we are talking all the time about EU AI Act, but how is it used already in the medtech solutions?
Well, we have about 90 applications already in the place, and it's in almost all of our equipment. So, for example, we recently launched a software which makes it possible to do an MRI scan in one third of the time you need normally for it, which leads to the result that either you just can have a much faster throughput and therefore bring this diagnosis better to more patients, or if you are not under a productivity pressure, also that happens in some countries in Europe, yeah, maybe not the European Union, but Europe, then you need much less power. So then it's a step in the direction of saving power and CO2 and sustainability. Yeah? So and as mentioned at the very beginning, so AI is a software, and AI should always support the healthcare professionals to help them to do their job, and not more and not less. I think that's important. Then, therefore, what you raised is very important to me, because not every innovation is then really something which is needed. Therefore, the collaboration so closely with healthcare professionals, with patients alliance is so crucial to really get it done. And just one sentence to your question before, because I think that's really crucial. I think we, and if I say we, I mean Europe. We have it in hands. If we implement the AI Act and the European Health Data Space in a way that it gives us competitiveness, that it does not increase the costs, that it does not bring the small and mid-sized companies out of Europe for innovating and bringing it to the market. So it's not that, because you asked the question, it's not coming from the moon and somewhere else is deciding. It's us in Europe deciding. And therefore, please, all together, stakeholders, but of course the decision has politics, and that's good and the only right thing, yeah? Please, let's get it done in a way that we are, after implementation, more competitive than we are now.
You're doing a lot of notes, Marco, so probably you would like to comment, but I won't let you to comment. I won't let you to comment right now, because I left for you even more difficult questions from the audience. And now, back to you, Mario. What the online and on-site audience is talking about, what are the questions for our panelists?
Yeah, there's a lot of discussion ongoing online, and maybe two main topics that I've identified. The first is, how do we make sure that we get the prerequisites of success right? So first, how do we get the capacity of notified bodies at a sufficient level? How do we ensure data quality to develop quality AI solutions? And the topic that comes up most is the issue of trust. And for that, there are a few particular questions. For the healthcare professionals, what is the role of liability? So can they trust the AI solutions that they use in general practice? For the citizens, can they see what tools are being used? Either which ones are being approved or which ones are already being used in their practice in their hospitals? And last but not least, a more philosophical question, are we willing to automatize certain aspects of healthcare?
Okay, so you have heard all the questions, and now you can pick up the one that is, about what you are doing and answer the question. I won't specify which question is to each of you, so just pick up a question and just answer. I will start with you. Liability.
Yeah, liability is definitely an issue. I think something that also came up is human-machine interaction, human-AI interaction. That's something that's, I think, as a healthcare professionals, we don't know. We really don't know how that's done, and then that links to liability, because only if this interaction is in a way that I maintain my, competence, or that I understand what the AI is doing, or that I have any means to control or to check if the AI did the right thing, only then can I, assume that liability, obviously. And I like very much the AI stuff that accelerates MRI, but if I get the images, then there's no way for me to know if those images were what would have been measured without AI. So there's certainly lots of things to be still decided with human-AI interaction, and then the liability comes with that, of course.
Sonia?
Well, I think we are on a journey. And I think we also should accept and be honest, and that's, again, a trust thing, to say that we are on a journey. Yeah? And what's clear is that AI will stay as an even more important part of healthcare. And radiology is in a way a start, because that's really something where it started, but it will by far not be the end. And therefore, it's crucial to think about if the one-size-fits-all approach we currently have with AI is the right one. I don't have an answer on that, but I think we need this discussion, and I think we should have this discussion quite honestly and openly, because also that builds trust, because people are feeling that's nothing like a car. Everyone knows how it is built and how it drives, yeah. But that's an I don't think a revolution, but it's an evolution, and therefore we need to come from all the different angles. And what we should have, that's of course something you cannot force everyone, but we all should have in mind, first, good intent, and secondly, and that's the most important thing to me, coming from different angles. Why are we doing that? We are doing that to produce better outcomes for patients and I think that's also important, at the end, lower costs. And if that's our common goal from industry, from patients, from notified bodies, from politics, from administration, and from industry, then I'm quite sure that the first question we had at the panel, will that make us more competitive in Europe, can be answered with yes.
Jelena, there was also a question about data quality. So how do you see it right now when you observe what is happening in the electronic medical records? Is the quality of data, medical data, on a high level right now, or it's to be improved?
It is certainly to be improved, again, for rare diseases, the situation is even worse than for more general conditions. Again, because of data scarcity, and sometimes it's actually the patients who are running the registry, and they might register that data in extremely diverse ways, non-harmonized at all, which makes it super difficult to combine with other registries, for instance, or with other sources. So. Here, it's another topic, of course, but the European Health Data Space name came up already, so I mention it again. We do have high hopes for a common standard for electronic health record, that this would help and encourage to record the data in a much, much better way, and this could be used and feed it to AI later, for instance, for the solutions, and to make them maybe less biased. In a certain way, because bias is also a huge problem for rare diseases, and female, male, kids, and all of that. So this problem are really, really shining bright right now and there, and it makes research quite complicated. And frankly, for some conditions, I cannot imagine building right now a reliable AI just because of lack of this initial data to fit in. So this is the starting point before we speak, I don't know, about any kind of solutions which will save us all. This is what we should speak about, and it's still a really, really big problem.
Annie, there were a lot of questions about regulation, about framework. Can you please comment?
Well, the one thing is what I want to pick up, there was the question about the capacity of the notified bodies. And I think this is, of course, a key question, because that was, I think, one of the main problematic points in the MDR. So we didn't get the infrastructure, the notified bodies, UDAMED, so the infrastructure around the implementation was not ready on time. I think now we're in a very good position, at least in our last notified body conference. Notified body says, yes, now we have capacities available, so we are ready. But what had to be done from the legislation was to really shift out to a very, very long time legislation. So actually we see 10 to 12 years that we get the implementation really done, and I think we want to avoid that for the AI Act. So capacities of notified bodies with the AI Act depend, of course, of the type of implementation. What we see now is a new notified body. We mainly get innovative and new products because we're not busy with the legacy devices. So what we see that already now we get, of course, applications containing the one or other AI application. So actually, of course, all notified bodies are designated according to codes. There are software codes, and within the software codes, of course, you have to have the technical expertise. So I think also all the other notified bodies, and as we do, we build up experts who have experience with AI, and we ensure that we can already now guarantee safe products and with a good benefit-risk ratio, because it's always, nothing is perfect, but has to be, of course, state of the art or beyond. So to look at that and to really look for the intended use, and does it somewhere help? So that's, of course, what we do already. We now know AI Act gives more clear requirements, clear regulation that will help us. So it depends on how, if we can keep this more or less working system and have somehow a smooth transition to only pick out the most risky parts, I guess it might be, it's now just a guess, it could be quite smooth. As I know, I guess not only we are building up those teams, the team in B is working on a common guidance on how to assess AI applications before the act comes in place. We're working already now on checklists or on methods on how to assess then according to the AI Act. So we are definitely preparing from our side, but of course we are very looking forward to the implementation acts coming to see is that the way things will go or is it going differently, and we will then of course adapt to what is prescribed for us.
Before we are approaching the end of the session, we have 3 minutes left, and before Marco will wrap up the discussion and also comment on the questions from the audience, last question for all of you, but please answer only with one sentence. So what is your call to action to make best out of the EU AI Act? Just one sentence, Daniel.
Focus on patient outcomes.
Jelena.
Sectoral rules.
Annie.
Don't make it too complicated.
Sonia.
Bringing to life in a pragmatic way for competitiveness of Europe.
And Marco, you have now 2 minutes to wrap up the session.
All right, I will try, and I will try based on this very interesting discussion. So let me start with this, that if we take Mario's questions and observations from the public, from, I don't know whether it's only here or online.
Online also.
We also, we are very clear on why we have a UI Act. You know, that's it. So that is a reaffirmation of the fact that you need to be sure that you are putting something into the market that you can trust. Now, I think that we need to go to details, because otherwise, you know, sorry if I do it in the concluding remarks, but if we don't do examples, I cannot elaborate myself, no, to the extent that I wish. And I wish, with this example, to reply to your observations, let's say, on these burdens, administrative burdens that you're going to put. Now, with the AI Act, especially for generative AI, the burden that the AI Act that you were referring to, I don't know whether it's a burden, but it's about transparency. So what we are saying is this is a risk management approach. If you develop an AI based on a certain training set, make sure that somebody can check whether what is there, it is valid for what I have to do. And we have the example, you know, I don't need to elaborate, you know, you have generated images between 2 endpoints, and the other one that says, let me see what is in between, right? And how this was generated. But now let's do the example, Let's do the example. The example is the following. And then you tell me again whether this is an administrative burden or resistance for supporting transparency. If you train a system on lungs images for detecting bilateral pneumonia or whatever for COVID, you know, and you use certain categories of lungs to train the system, and then you export that solution and you use, for instance, for kids or people with another nationality, the system doesn't work. So if I ask, please, can you check whether the training set that you used contained the bias? Well, okay, some may call it as an administrative burden. I would call it as a transparency vis-a-vis what we heard, that is the patient outcome. So I close with this positive note of the journey, because I guess that we are embarking here, especially for solutions which, you know, we are developing. We're talking about frontier research, because when it comes to big solutions, that's what we are talking about. We are sure that every actor, including those that will develop technological solutions by fine-tuning, you know, huge apps, huge AI apps based on huge databases. So also those that fine-tune, they are sure that what they are working on, you know, does not contain bias, for instance, that there is this transparency rules. So, you know, my note and my conclusion is that it was an interesting reaffirmation about the importance of having a conducive environment for innovation through regulations that are forward-looking, that in a way, yes, the implementations of it will be something that we will have to do together, especially on some aspects where say we yet don't know, but that's when you deal with frontier technologies. So yeah, I am very happy that I came here and I got these notes that will also be useful for my colleagues, and I do hope that the combination of the AI Act, the European Health Data Space, and the data infrastructure, which were not mentioned today, but which we are already deploying, including the cancer imaging database that will allow, and probably also for rare patients that will allow to discover links that otherwise, you cannot discover, will become a reality. And will become a reality in a way that is safe for you to adopt. Thank you.
I think that we could continue this discussion for the next hours, but we are also regulated and we see already a red screen blinking here. So once again, Marco Macea, Sonia Wexley, Annie Kolbeck, Jelena Malinina, Daniel Pinto dos Santos, thank you very much.